Hello everyone, welcome to OMTR to RO seminar by the College of Natural Health Sciences Bermuda. My name is Dr. Delcina Bean Burrows and this is lecture number 1. I am very excited to welcome you to this course and this class because it means that you are in the Bridge program. The Bridge program that takes you from being a level 1 OMTR, osteopathic manual therapist registered, to a full-fledged registered osteopath. So I am so excited to welcome you to this class and to your journey towards becoming a registered osteopath. Let's take a look at the course objectives. They are as follows. The overarching course objectives are to gain a thorough understanding of the OMTR to RO process, familiarize the student with the scope of the registered osteopath's practice in Bermuda, build the transitioning clinician's confidence level to execute competent practice as an osteopath, familiarize students with proper documentation and administrative practices, gain an understanding of the similarities and distinct differences between osteopaths, chiropractors, and physiotherapists, reintroduce students to specific clinical concepts such as evidence-based practice, medical errors, and overtreatment, and identify clinical practice needs such as therapeutic furniture, equipment, etc. At the end of today's lecture, we will gain an understanding of the Bermuda Osteopathy Association's new mandate regarding OMTR Level 1 practitioners, refamiliarize the student with the scope of OMTR Level 1 practice, be able to discuss the duties of the Level 1 OMTR, become familiar with the scope of practice of the registered osteopath. So we begin today's lecture by taking a look at the Bermuda Osteopathy Association, nicknamed BOA, their mandate. And as many of you already knew, as of April the 1st, 2026, the Bermuda Osteopathy Association will be phasing out the Level 1 Osteopathic Manual Therapist designation and bringing all current registrants that hold that status up to international standards as fully qualified osteopaths. BOA's aim is to ensure that practitioners possess the advanced evidence-based skills that are needed for an ever-changing and complex healthcare system. Since 2008, the need to provide precision medicine has increased exponentially on a global scale. BOA therefore aims to meet such challenges locally by ensuring that registrants are ahead of the trends and that they are able to assume more definitive roles in research-informed care, critical thinking, and clinical leadership. The OMTR-RO educational requirements are such that BOA has mandated that the Bermuda OMTR registrants must be enrolled in an accredited bachelor's or a master's degree program in osteopathy in order to maintain active and good standing registration status. Upon completion of an accredited program, BOA will therefore automatically upgrade members' registration from Level 1 OMTR to Registered Osteopath. So we're going to now take a look at the description and scope of the Level 1 OMTR, which you are already familiar with because you are a practicing OMTR. However, we're going to just take a look at that so that we can see how it is different from that of the registered osteopath. Osteopathic manual therapists, OMTs, are fully qualified professionals who use evidence-based, highly trained sense of touch and palpation to assess imbalances or dysfunctions within the body and facilitate the required techniques as appropriate for each individual. OMTs are educated to the Diploma, Associate of Applied Science, and/or Bachelor of Science degree level. Level 1 OMTs can only refer to themselves as osteopathic manual therapists and not osteopaths or manual osteopaths because their scope of practice is not as broad as osteopaths and manual osteopaths whose training goes beyond the bachelor degree level. Level 1 OMTs are usually qualified professionals in other disciplines such as massage therapy, personal training, physical therapy, occupational therapy, and exercise physiology. Level 1 OMTRs are registered with local regulatory agencies or associations. They comply with the association's published code of ethics and code of conduct, and they carry malpractice insurance and practice well within the defined scope of osteopathic practice. So let's take a look at what a level 1 OMTR scope of practice, what that is. First of all, a level 1 OMTR will perform client history taking through client interview, health questionnaire, medical records review, and health team collaboration or consultation. They will perform a thorough osteopathic musculoskeletal assessment or evaluation, which will include range of motion, manual muscle testing, symmetry observation, deep tendon reflexes, sensation, postural analysis, special tests such as Patrick's, Herman's, and Tinel's sign, as well as be able to perform vital signs. OMTRs will also be able to identify musculoskeletal conditions and abnormalities, which is a clinical diagnosis or clinical impressions. They will be able to devise a treatment plan or a plan of care according to the client's condition, existing diagnosis if known, and osteopathic assessment findings. They will use direct and indirect osteopathic manual therapy techniques to address conditions and abnormalities such as soft tissue therapy, myofascial release technique, muscle energy techniques, joint mobilization, still technique, facilitated positional release technique, lymphatic drainage techniques, strain counterstrain techniques, balanced ligamentous tension technique, and combined osteopathic techniques. They will also be able to blend osteopathic techniques with other therapeutic techniques as indicated, such as proprioceptive nerve facilitation, PNF, neurodevelopmental treatments, which is abbreviated NDT, deep tissue massage, Swedish massage, reflexology, and acupressure. The level 1 OMT will also be able to provide treatment in accordance to a physician or osteopath or doctor of physical therapy, doctor of occupational therapy, or doctor of chiropractic referral. They will be able to provide general advice regarding proper body mechanics, joint protection, and energy conservation. They will also be able to provide general advice regarding healthy lifestyle choices, such as they can advise their clients to stay hydrated and to eat a healthy diet. They can advise their client to try to maintain a healthy weight or BMI, body mass index. They can advise their client to quit smoking if they do smoke. They can caution their clients about alcohol consumption. They can also encourage their client to obtain regular exercise. They can encourage their clients to try to manage stress if that is an issue. They can also advise their client to get between 7 to 8 hours of sleep every night. And they can ask or advise their clients to maintain a healthy work, rest, play balance. And the level 1 OMT will be able to refer clients to specialists for care that is outside the scope of OMT practice. They can make recommendations for medical intervention, such as sending the client back to their GP when necessary. The level 1 OMT can submit claims for health insurance reimbursement, and the level 1 OMT can maintain and secure the client's records for at least 10 years after discharge. Now let's go ahead and take a look at the description and scope of the registered osteopath. So what is an osteopath? Well, an osteopath is a qualified healthcare professional who focuses on the clinical diagnosis, treatment, and prevention of musculoskeletal issues, particularly concerning joints, muscles, and the spine. Osteopaths use manual techniques like massage, stretching, joint mobility to improve health and mobility, often treating back pain, sports injuries, and headaches without relying on medication. Osteopaths can design home exercise programs for their clients and use physical modalities during treatment sessions. Osteopaths are on par with chiropractors, physical therapists, occupational therapists, and other rehab professionals. So we can note here that everything that the OMTR level 1 practitioner can do, an osteopath can do those things in addition to the designing of home exercise programming, using physical modalities, and also their qualifications, putting them on par with the physical therapists, the occupational therapists, the chiropractors, and so on. Those are the main qualifications. So whereas an OMTR level 1 professional is not necessarily viewed as being on the same level as these other professionals, the fully qualified registered osteopathic professional is on par with these professionals. Now, in terms of the characteristics of osteopathic care, it is characterized by manual treatment. We use techniques such as massage, joint mobilization, and stretching to reduce pain and improve mobility. We use a whole body approach. Osteopaths treat the body as a whole, focusing on how the musculoskeletal system influences other bodily functions and systems. We use clinical diagnoses and management, and as primary care practitioners, osteopaths perform physical assessments, evaluate posture, and create tailored treatment plans accordingly. Osteopaths do not replace the need for primary care physicians, but rather we work alongside them to support clients and patients. Now, in terms of advice and prevention, we provide advice on posture, exercise, and rehabilitation to help prevent injury recurrences. So how is the registered osteopath regulated and what is their scope of practice? Well, in Bermuda, osteopathy is a self-regulated primary healthcare profession focusing on the clinical diagnosis, treatment, and prevention of musculoskeletal and related disorders. Osteopaths are considered allied health professionals, and while often working in private practice, they are qualified to act as first contact practitioners, allowing patients to self-refer without first seeing a GP. The scope of practice is guided by the Bermuda Osteopathy Association locally and the General Osteopathic Council in the UK, which requires all practitioners to be registered, ensuring they meet strict standards of safety, competence, and conduct. The key areas of practice is much the same as level 1 OMTR, but we will review them here. musculoskeletal focus. The majority of work involves treating conditions affecting the muscles, bones, ligaments, connective tissues, and joints. Common conditions treated are back pain, neck pain, headaches and migraines, arthritis pain, minor sports injuries, sciatica, joint stiffness, and postural issues. The patient demographic: care is provided to a wide range of patients, including children, athletes, older people, and pregnant women. The holistic approach that osteopaths use looks beyond the immediate symptoms, considering lifestyle, work, and general health to treat the whole person, focusing on the relationship between body structure and function. The most common conditions treated by osteopaths include thoracic outlet syndrome, shoulder pathologies, hand and wrist conditions, elbow pathologies, cervical radiculopathy, tendon overloads, low back pain, postural disorders, hip pain, headaches, migraines, knee pathologies, ankle and foot pathologies, and many more. Now, in terms of the specialized areas of osteopathic practice, many of these specific areas that we're going to look at will require you to go beyond just obtaining your master's if you want to specialize in these areas. And we're going to go through them here, such as pediatrics. This involves treating babies, children using gentle techniques, including cranial osteopathy. Pregnancy, pre and postnatal care, treating women with gentle musculoskeletal techniques to relieve discomfort caused by pregnancy. Cranial osteopathy, this is a refined, subtle approach often used for headaches, trauma, or infant care. Sports rehabilitation, you're going to be working with athletes to treat injuries, enhance performance, and provide rehabilitation, often in multidisciplinary clinics. Animal osteopathy, or equine canine, this is a growing area, field of study focusing on animals, particularly horses and dogs. Chronic pain management, geriatric care, focusing on mobility and pain relief for older patients. Visceral osteopathy, this is focusing on the relationship between physical structure and internal organs, such as treating digestive or respiratory issues. And osteokinesthetics. This is a dynamic, non-invasive model of intervention that combines osteopathic manual therapy techniques, holistic aesthetics, clinical aromatherapy, kinesiology, reflexology, and neurolinguistics for the overarching purposes of balancing the body. So, as you can see, osteopathy is a growing field and it's also an exciting field. So we have reached the end of lecture number 1. And for your assignment, I'd like for you to provide a definition for the level 1 OMTR, provide a definition for the registered osteopath, and discuss why you decided to enroll in the Masters of Science Osteopathy Self-Study Bridge program. Now, this assignment is due when it is due because you're in the self-study program. However, I do recommend that you stick to a schedule and try to always get your assignments in at the same time every week. So, for example, the structured programs, the ones that are not self-study, assignments are always due on Sundays by 11:55 p.m. And if you need to enforce that structure on yourself so that you don't lose momentum, then I recommend that you follow that schedule even though you're in the self-paced course. Now, I do recognize that sometimes life happens and we're not always able to meet deadlines. But if you stick to that deadline, it would do you a world of good because you get into that routine and it just helps you to maintain your momentum and consistency as you go through the program. Okay, so with that, I look forward to receiving your assignments, and I will see you in the next lecture.